Welcome to the only place where real, raw, and vulnerable conversations happen with IFBB bikini pros to give you an inside look at their struggles, strategies, mindset, passions, and all of life beyond the stage. This podcast is made to inspire, motivate, and remind competitors and the average gym goer that even the most extreme lifestyles and elite athletes have their ups and downs. Thank you so much for tuning in today. I'm your host, Celeste Rains-Turk, and now it's time for the Confessions of a Bikini Pro podcast. Today's Inner Health Series episode is with a company called Liv Health that provides longevity medicine through personalized health strategies with the expertise of doctors to determine the best holistic approach to rebalancing biochemistry on many levels. And I had the chance to talk with two of the representatives, one of whom we're going to be speaking with today. And I'm excited because I learned a lot from that conversation, and I think it'll be great to bring it to this series. So today we're going to have on Julia Bresner and Andrew Wax. Julia is the lead integrative health concierge who works collaboratively with patients to identify their health and wellness goals, with 12 years of experience working one-on-one as a certified functional medicine health coach and holistic nutritionist with patients, guiding them on their nutrition, fitness, hormone supplements, and lifestyle. And Andrew is the director of clinical care who's certified in peptide therapies and has degrees in integrative physiology, biochemistry, psychology, neuroscience. I mean, the list goes on. So welcome to the show, you guys. How are you doing?
Hey, it's great to be here. Yeah, thanks for having us.
Of course. I've been looking forward to this, and I think that we're going to have a really educational and informative episode. And, first things first, this is an inner health series. So I would love for maybe one of you to share how Liv Health can and has been used for bodybuilders in the past, and why you believe it's important for performance and longevity in this sport.
Right. Absolutely. So we work with several bodybuilders right now. And most of them are working with us to figure out the best approach to becoming superhuman by essentially becoming the optimal human, right? So many people, and I'll probably mention testosterone so many times on this call just because it's so well known in the space. But the example that I like to use a lot of the time is a lot of people say, well, testosterone is great. It'll solve all your problems. So then they go on testosterone and then they don't get the benefits that they want. So then they increase their testosterone, and then they still don't get the benefits that they want. So then they increase their testosterone. And it's just not quite that simple. So what we do is we come at it from a very different standpoint, a holistic standpoint, to say, okay, how are you doing metabolically? How are you doing from a standpoint of thyroid and hormone, overall hormones? And especially for your female clients, I think our female clients we're working with, it really comes down to an equal balance of your sex hormones. So it comes down to nutrition, appropriate sleep hygiene, really running the gambit with a mindset, cognition, being the best human you can be.
Love that. And can you guys define for me what it means to be superhuman, or how you classify like optimizing the way that we function?
Yeah, I think, when we say becoming superhuman, we really are talking about optimizing, coming to your health from a standpoint of looking at every single thing with your health and wellness and getting it to a point that's ideal for you. And it's so personalized, right? Everything we do is so personalized, but we're looking at a combination of your history. We're looking at what your goals are. We're looking at your labs to really custom create a protocol for you that's going to help improve not only your longevity, right, but your health span. So the quality of those years that you're living. So when we say superhuman, we mean really functioning at 100%. To have, all the energy that you want so that you can live a longer, healthier life.
Love that. No, I think it's really important too for competitors to consider longevity. That's something that I preach all the time as far as like a mental perspective. But physically, if our bodies can't sustain the goals that we have or the efforts that we want to commit to, we're not going to get very far. So I think some people will probably listen to this and wonder, well, what is the difference between what you guys are doing and what their primary care doctor might do?
There's a lot of differences. It's interesting because we get that question a lot from our patients or from people that are interested in working with us, but we're not a primary care, right? And I joke with people all the time. I say things like, I don't want to talk to you when you're sick. I want to talk to you when you're healthy, and I'll make you healthier. Now, of course, I'll talk to people when they're sick, but it's an interesting circumstance where in a sick care model and in an insurance-based model, their goal is to make you not sick. Now, not sick does not necessarily mean healthy, right? So for us, it's more about, hey, let's take you being this not sick state, which is relatively healthy, I guess, and make you even healthier. So one thing that, you go to your primary care doctor and they're going to pull some labs on you. Maybe they run a basic blood panel. Maybe they look at a basic lipid panel. Maybe they might run a couple of hormones if you really beg and plead with them, but they'll look at all those labs and they'll probably check them out and say, yeah, they all look good. But then after the fact, you're kind of looking at it and you're like, well, my thyroid is on the high end of normal. My TSH is on the high end of normal, but I mean, I guess it's within the range, so that's fine. But you can't tell me that everybody who's in that range is doing just fine, right? There's got to be a number there that equates to optimized and perfection, right? So our goal when we look at labs, very different from how your primary care looks at labs, is to say, hey, how can we get you to this optimal state, right? So it's really about looking at micronutrients. It's about looking at all of your hormones. It's about looking at your insulin sensitivity. So many of these bodybuilders out there are using, hey, I just did a hard workout and I'm going to get a post-workout insulin secretion so I can get some really great glucose uptake. So I'm going to eat some Lucky Charms. And that's just doesn't really seem to be the answer. So it especially not the answer if you don't have perfect insulin sensitivity. So I digress here, but the answer is a lot of stuff is different, right? We're not going to be the people that manage your antibiotics. We're not the people that are going to treat you for you come in with the sniffles or an ear infection. But rather we're the people that take your performance and your care to the next level.
Yeah, I think too, one of the biggest differences is that a lot of people will, come in and say, I'm feeling good, but I know I could feel better. And I went to my doctor and they said that I'm in range on everything. The problem with that is that range is based on the average American. And what we know is that the average American's not super healthy, right? So why are we, comparing ourselves to the average American? And that range that our regular PCP doctors are looking at, it's the same for somebody who's 25 as opposed to somebody who's 80, right? That range is the same. So that is a huge difference as well, is that we're not looking at your traditional labs and comparing them to the range of the average American.
That's a really important point, because I was just talking with someone else in the Inner Health series and we kind of got on that subject too, of like, you can't really compare an elite athlete to the average American. It just,
right.
It doesn't make sense at all.
No. It's insane. Well, I joke with people all the time. It's like, have you walked around Walmart recently?
Right.
What have you seen what the average American looks like? Mm-hmm. That's not a healthy person.
Exactly. Yeah. And it's like, I don't know. I think it's important for athletes to consider too, like, because we're not necessarily the average person, we also have to then do above average inventory of our body, so that we're not, putting average, I guess, oil into a better machine, if you want to use that type of analogy. But something that bodybuilders get concerned with, of course, is muscle development, especially natural athletes. We want to capitalize on building as much muscle as possible, especially from season to season, without sacrificing our health in other ways, like maybe too much or excessive fat gain or yo-yo dieting. So can you explain how optimizing inner health might support someone with building muscle and maintenance phases and then fat loss phases?
Yeah, I absolutely. Yeah. So it often comes down to, that you mentioned the yo-yo dieting, right? And well, I think it's important to know, well, why is yo-yo dieting so bad? Well, because it eliminates metabolic flexibility. So the more you yo-yo diet and you don't reverse diet properly coming off a cut, or you bulk too quickly and then you cut too fast, is every time you do that, you're risking just crushing your metabolism. You're risking gradually slowing your metabolism, and it's hard to get that back. So one example that I like to bring up is the the example of The Biggest Loser, right? Biggest Loser, and there was a New York Times article a few years ago that came out where they all gained the weight back, right? And well, why did they gain the weight back? Well, because when you go that crazy in fat loss, in extreme dieting and extreme exercise, your body's a set point and works to get back there. But what you find is as soon as it gets back there, you maintained your lower metabolism at the lighter weight. So then now you have to drop your calories to, a third or a fourth of what you're doing before, so that you can maintain that fat loss after the fact. So yo-yo dieting, really what it comes down to is you're just eliminating that concept of metabolic flexibility, which is essentially the amount of stress that your metabolism can take on. I think, Julia, you probably have a lot of points you can make here in terms of dieting and on the extreme here with muscle building.
Yeah, for sure. I think, one of the biggest things too with dieting is that it puts so much stress on your body. So not only does it put so much stress on your metabolism, where, in the future, if you don't reverse diet properly, you have to eat less and less, but it wreaks so much havoc on your gut health, on your sex hormones. You're depleting a lot of vitamins and minerals. And so, when your body's in that stress state, people are also going to have a lot harder time building muscle. And so the constant yo-yo dieting, it just wreaks so much havoc on every system in your body. So really coming out of a diet or a cut, if you will, in the right way is so important to future success of bodybuilders, but also long-term health and longevity, right? I've worked with a lot of different bodybuilders who have come out of being stage ready with so many gut issues. And it's because of the constant stress on your body that, bodybuilding can put on there if not done properly.
Well, that brings up an interesting point then. How do you know if you have, how do you know you yo-yo dieted, or how do you know if you've maybe reverse dieted improperly or too quickly?
Gotta run labs.
So
you can't manage what you don't measure, right? You got to run labs. You got to know what's going on. You should be following your lab metrics throughout your season. You should know what's going on with your liver, your kidneys, your total protein, your albumin. You should know if you're metabolically acidic. And these are all things you can track through labs. You should know if you're estrogen dominant as a woman. You should know what your sex hormones look like as a guy. You want to know what your thyroid looks like, your cortisol. It really, again, labs, blood is king.
Yeah, I absolutely agree. I think labs are super important. And I also think one of the things that I've seen with a lot of female, bodybuilders is that they're constantly either in a cut or a bulk. And I think people don't spend enough time, kind of at that maintenance zone, right? So you're in a diet, you slowly reverse back up to maintenance and you stay there. Your body is comfortable there. And I think a lot of people don't spend enough time doing that. So just off the bat, if you're someone who is always in a cut or always in a bulk, and you're in one of those seasons all of the time, that would be really beneficial for your body to spend time at your maintenance. And so that's something that's, just to pay attention to as well.
Well, I really am glad that you said that, because I'm going to dig a little deeper on this subject. And I think what happens is when you do go back and forth so much from prep life to maybe, if you want to call it bulk life, you forget, or you don't know your body, like, what is your maintenance anymore? Do you have a new set point? And it kind of goes back to the earlier conversation, even about Biggest Loser, so I'm trying to understand how do you find your maintenance? Obviously people will be working with their coaches, but what might you be looking for in the lab work to support you in knowing, okay, now I'm at my maintenance?
I think when you're talking about maintenance with like calories, for example, of course, it's going to be a little bit of a trial and error. So I can actually use myself as a good example. I come from a background of, kind of being in a caloric deficit all of the time, a lot of the time, because I have a background of an eating disorder, 15 years ago or so. And so I really put a lot of stress on my body, and my metabolism was kind of really in the tank. And so in order for me to find that maintenance, I actually just slowly reverse dieted, and I'm a big proponent of it doing it really slow. So instead of adding, hundreds of calories per day every week, slow amount of increases over time. And actually your body's just so fascinating because it can adapt. You can increase your metabolism by doing a slow reverse. So for example, like previously, if I was eating 1,200 calories and I was maintaining my weight, now I can eat 2,000 plus calories and still maintain my weight. And it's because I did a slow reverse. Your body can readapt.
I 100% agree with that. So many of the people that you see here that really start to have problems, it's because they do things perhaps too quickly, right? Things need to be, you need to pump the brakes on a lot of this stuff and really take a much slower approach. Then your body doesn't fight to get back to where it wanted to go so quickly. And to Julia's mentioned there, 2,000 calories is, great. From 1,200 calories, that's delicious.
Yeah, exactly. And you guys mentioned too, like there are a lot of things to consider, like thyroid and sex hormones and insulin sensitivity, and you mentioned metabolic acidity. So I'm not familiar with the acidity section of things, and obviously you guys are experts in these other things, but can you explain maybe to our audience what you notice negatively impacts these important markers the most, and what types of behaviors might positively impact this that they could consider implementing?
So what our doctors look at to evaluate if you are metabolically acidic is your carbon dioxide levels. Your carbon dioxide levels in an optimal range, what a lot of our doctors recommend is that you really should be around 27, 28, or even a little bit higher. Now, the higher that is, the more alkaline you are. Now, your body likes to be alkaline or basic in its nature. So all of these fancy waters out there, these alkalinized waters, these people that are drinking lemon water, they're not full of shit. They're actually not. Because if your body is metabolically acidic, meaning you're really not eating enough cruciferous vegetables, you're not eating a high fiber diet, and you're really focusing just on protein and carbs, you are at risk of becoming acidic. And if you are in a state of a lot of hypertrophy training with eccentric loading, you're also at risk for building up a lot of lactic acid, which also puts you into a state of acidosis, right? So lactic acid, for the longest time, everyone said, oh, lactic acid, it makes you sore. But no, not really. It's the microtearing of the muscle that makes you sore. But what lactic acid does do is interfere with your mitochondrial efficiency and your body's ability to make energy. So bear in mind here, if you're overly acidic, you're going to reach a state of fatigue quicker because your body simply can't keep up with that metabolic output and, as many reps as you're trying to get. So you can get a greater performance benefit by alkalinizing yourself, by making yourself more basic. That's a really easy thing to do by throwing something in like baking soda, which is sodium bicarbonate. So all of these bodybuilders and people over the years, they say, oh, take some baking soda. This is why, right? To make you a little bit more basic. Your body loves alkalinity, right? Your immune system functions better. You have less pain. Your brain functions a little bit better. From a performance standpoint, there are studies that actually support you can see up to an 8% improvement in metabolic output after using something like sodium bicarbonate, which again is just baking soda. Now, there are other options out there. There's one supplement company called Claire Labs that produces a sodium potassium bicarbonate, which I actually like a lot because it's sodium and potassium. You're not just getting the sodium there. And the last option that a lot of our doctors recommend is something like Alka-Seltzer Gold. The Alka-Seltzer that doesn't have any aspirin in it. So that's a way to easily alkalinize yourself, and you can do so in a pre-workout format to really improve your metabolic output and the quality of that workout in and of itself. And then you're also supporting longevity there, right? Your body likes to be alkaline.
Dang, Andrew, you just dropped all these great tips. That was awesome. Are people now, I guess this might be a silly question, but if I'm wondering it, others probably are too. If someone were to say, well, I'm just going to start with baking soda, for example, or I'm going to start with lemon water, whatever. Are they eating it? Are they drinking it? Is it in a pill form?
Yeah, so it's so typically baking soda, you want to start conservatively. And again, you need to be measuring labs. You need to be checking what you're doing because you can do too much, right?
Mm-hmm.
And you need to know what's going on. So again, you can't manage what you don't measure. That's like
So don't go in blindly. This is the
everyone.
disclaimer.
Yeah, don't go in blindly. But it is relatively safe. And generally somebody's going to use something like sodium potassium bicarbonate or sodium bicarbonate baking soda and just mix a fraction of a teaspoon into a glass of water, right? That can be very helpful. And that's what a lot of our doctors recommend there. Other of our doctors recommend Alka-Seltzer Gold, 1 or 2 tablets a day, and effervescent tablets and water. And then another, like I mentioned, that Claire Labs is a capsule. And some of our doctors will recommend, hey, this is a really great thing to take, 1, 2, 3 capsules pre-workout about an hour ahead of time. It really just depends on what the patient needs, though, right? It needs to be, everything needs to be custom tailored to the client, to the patient.
Well, I can imagine that if someone was already in a good state, is it possible for them to take too much and then actually throw off their system?
Yeah, absolutely.
Okay. So again, that reinforces the importance of actually checking, not just throwing shit at the wall and hoping something sticks.
Exactly. Exactly.
So I just wanted to drive that point home. But I find it really fascinating because this kind of speaks to the earlier point of you're healthy, you're functioning, you're performing as an athlete, but can you be even a little bit better? And could that little bit better make a difference in terms of your career, whether that's longevity or it's placings or it's how you feel about the processes? So I'm finding this really interesting. And the next thing I want to ask you guys is there anything you would suggest for competitors to consider right off the bat that could improve their health? Aside from what you've mentioned here, you mentioned the cruciferous vegetables, getting your fiber in, all of these are really great recommendations, but maybe as far as something they could monitor or monitor on their own right now to improve their health.
Yeah. I mean, I think,
Julia, go ahead. You got it, Julia.
I think it's important, for, like we keep saying, like you can't manage what you don't measure. So I think not going in blindly and to kind of get like a baseline of where you are. So running, I would say sex hormones, thyroid health, metabolic health, certainly important to get that baseline and then really making the recommendations from there. Because normally I would say, at least from my standpoint, right off the bat, without knowing where you stand, it's hard to say, okay, this is going to make you perform better, right? This is going to make you place better without knowing kind of what's going on. So I certainly recommend, getting that lab and then making the recommendations from there. Andrew, you might have some of your people off the bat without doing labs, but I always think labs first, and then we can make those recommendations.
No, totally. I think knowledge is power, right? So, and my recommendation was actually very similar, but I think, using a CGM, a constant glucose monitor. So many, again, back to the Lucky Charms example. I know a lot of bodybuilders that post workout, they're like, I just need to get some carbs in me so I can take advantage of, throwing this glucose directly into my muscles. So, I'm carb loading or whatever it is, but, you're really eliminating your insulin sensitivity in that example. And by doing so, you limit your body's anabolic potential. So if you could know for certain how your body responds to carbohydrate load, then you can really figure out the best under what circumstances you need to eat high carbs or when you're going to get the best bump out of your glucose uptake. so that you can really push all of that sugar into your cells so that you can get, again, the greatest benefit there. So I think a CGM is great. Unfortunately, that is, that's a prescription option. You have to get a doctor to order that for you, but that's relatively easy to get. There are companies out there that you can get a CGM through. And I think it's something that we're working on as well to, have a direct to consumer option. If you ever see somebody that's wearing those little white, I guess, little circle on the back of their arm or something like that, it's a CGM, it's a constant glucose monitor. And what they're doing is a lot of diabetics use them, but a lot of people in the longevity space and performance space are also using them to see, okay, how can I really monetize on my insulin sensitivity?
Yeah. The other thing I'll also throw in here, just because I've had experience with women bodybuilders, is the women I've worked with, they have been on birth control. And it's something to bring up because, as you probably know, birth control depletes a lot of vitamins, B vitamins, selenium, zinc. It can actually, really affect your performance. It also can disrupt, the normal flora of your gut. It kind of increases your sex hormone binding globulin, which makes a lot of your hormones unavailable for use. And so one thing I sometimes recommend for women that are on birth control that are also in the bodybuilding space is making sure that they are supplementing with the things that birth control depletes. So like I said, B vitamins, zinc, selenium, things like that, which are also really important for thyroid health, which also gets lowered a lot of the times when you are eating low calorie and cutting.
Oh my goodness. Julia, thank you for bringing that up too, because that's something I was going to ask you actually. So it's great that you just mentioned those things. And that was some really good feedback and insight there as far as what competitors can do. And then you left off on a point that I was like, okay, now we got to cover this because a lot of competitors, we get depleted in energy, yes. Sometimes has brain fog. And a lot of this obviously is the caloric deficit and the extreme, efforts we're putting into the gym. Mm-hmm. How might you support an athlete through this without bringing them out of prep mode?
You mean in terms of the depletion
and the brain fog or feeling low energy? How could you help someone without telling them like, hey, it's time to get out of prep right now, and when maybe they're like 3 weeks out from their show?
Right. Well, I do think, as I mentioned, depleting B vitamins, selenium, zinc, those are kind of the main things there. But one of the things I also recommend for just more stable energy is whether you're in a cut or not, eating a combination of protein, fat, and fiber at your main meals is going to help keep a steady blood sugar. And this is really going to help with energy, because when you eat, for example, carbohydrates by themselves, they spike your insulin, right? And that makes you actually crash faster than if you were to pair that with some fat or fiber. So I do tell, my clients, try to eat a combination of protein, fat, and fiber together throughout the day so that you have a constant stream of energy and that you're not experiencing as many crashes throughout the day. That's something I certainly always recommend. So that's one. I also supplementation, look, vitamin D, B vitamins like methylcobalamin, that's going to help with energy as well when you are feeling depleted. So those are some, small steps.
Yeah, those are great.
You can also get into, and I think that's a really good place to bring up the role of hormones, really. Mm-hmm. So as you start to go into a cut and, your thyroid starts to get depleted because now you don't have the selenium and the iodine, then all of a sudden your adrenals are depleted because your thyroid and your adrenals go hand in hand. And now because your adrenals are on overdrive, all your progesterone that you have is not being metabolized into a form that's going to combat estrogen. Now all of a sudden you don't have any progesterone left and you're feeling estrogen dominant. Now that you're estrogen dominant and you're also on birth control, you have no libido because your testosterone is getting sucked out by the sex hormone binding globulin, and you're not feeling like a normal human. So throughout that process, it's so important to maintain that supplementation, but it's also really important, again, to keep track of those hormones. There's there's no, there's nothing wrong with supplementing with some progesterone as you need. There's nothing wrong with throwing some testosterone in the mix as you need it, as a man or a woman. Unless of course you're at a, in a natural competition. That said, that's really where it comes in. So the goal in a lot of bodybuilders going in the direction of, I use testosterone so I can have super physiology. For us, it's more about, let's support this so that you maintain a state of normalcy so that you can achieve your goals and that you feel awesome throughout this process. So I don't know, it's a very circuitous circumstance when you start talking about, everything's interconnected, everything, with your hormones, your diet, your supplements that you're adding into the mix. It all plays into one another.
Well, I could see how having support from someone like you guys that is actually a system and having it all mapped out would make this a lot easier, because we've already learned so much. It's been like not even 30 minutes, and there's been so many amazing things said. And I think, one, you already mentioned, it needs to be personalized, but two, it can be overwhelming because there's so many systems that exist within our one being. So it is confusing, but I want to ask this random question. How important is supplement timing?
Depends on the supplement. pretty important. It's pretty important. Did you have a specific supplement in mind?
Well, I guess I'll think of some that come to mind that I've seen bodybuilders post about, but like vitamin C, for example.
So vitamin C is a liposomal vitamin. It, whether or not you take it in the morning or night, you take it fasted or not, if you're taking the absorption of it is not really going to be affected all that much. It's not going to be like, oh, I took it at one time and it's a total game changer in terms of my results. But it is no. So no, with vitamin C, probably not. Vitamin D, yeah, that does matter. Vitamin D is a circadian hormone, right? Something you should take in the morning. You should take it with food. It's fat soluble. Something like B12. B12 is a water soluble supplement that generally, I guess you should take it on an empty stomach. Is it really going to hurt you to take B vitamins and B12 on a full stomach? No. And is it really going to affect your absorption of it? It's not going to be the game changer. It's not going to be the nail in the coffin. But if you really wanted to be the best you could be, then you really got to figure out if things are fat soluble or water soluble and determine when your body would naturally produce those hormones or those supplements. Or, I use hormone as an example because vitamin D is more a hormone than is a supplement. Yeah.
So yeah, I get a question about creatine quite often in terms of when it should be taken. And, the latest research, it really doesn't make that dramatic of a difference if you're taking it, pre-workout, post-workout. So my response in terms of creatine, if anybody of your listeners wonder about that, is whenever you're going to be consistent, right, is most important. So there have been studies that show like a tiny little bit of benefit, taking it pre or post workout, but really it's whenever you're going to be consistent. Because I know creatine I get lots of questions about the creatine timing.
I'm glad that you brought that up for sure. And, thinking about these types of variables, I know that as an athlete and a business owner and doing all these other things in my life, being a full-time student, I don't really care. I don't want to think about these things. I care in the sense of I want it to be beneficial for me. But I don't care to do all the research. I'd rather someone else do it. So do you guys at Liv Health, do you take someone's plan? Like, let's say an athlete said, this is exactly what my coach has me doing right now. This is the time that I work out, wake up, go to bed, all that. They send you all these variables. Do you then structure whatever their protocol is according to those variables?
I mean, yeah. So, I mean, if somebody comes to us and they're already, are you saying they're already working with a coach and they have a lot of kind of different, yeah. I mean, we said everything is personalized. And so we're certainly going to take into consideration what they're already doing and what their coach is recommending in terms of how our protocol goes. But again, like Andrew said, certain things need to be taken at certain times so that they mimic kind of the natural rhythm of your body. But yes, we'll certainly can work with somebody who already has a coach and make sure that we're all, on board on the same page for sure.
Awesome. Okay. So I want to talk to you guys about how Liv Health system works, but first, what I want to talk about next is because Andrew did just bring this up, but how does hormone replacement therapy or peptides work and get chosen or provided for a customer or client of yours?
Yeah. Ooh, peptides.
Yeah.
Peptides are one of my favorites. So peptides are really cool. Peptides are tiny signaling molecules in your body that are, and a lot of the bodybuilding community is familiar with them, things like BPC 157 or TB 500 thiamine beta 4, or peptides for growth hormone production. But generally, looking at these tiny small molecules that are generally administered by a tiny injection, they're generally very safe. Again, need to be working with physician oversight, but they are generally very safe and they're very targeted. So peptides, truthfully, as cool as they are, and they really sound like magic when you're looking at them, they're like a sniper rifle. They're so specific, right? And it's typically not something that you throw into the mix right away. It's much more important in my personal and my own wrong opinion. I think everyone has their own wrong opinion. In my wrong opinion, I think you should figure out your hormones before you go to peptides. That said, peptides are very cool. But in terms of hormones, you got to run the labs. You got to see what's going on. You got to see if, how aggressive you want to be and what you want to include in your plan. And if labs indicate that, hey, this is something that's an option for you, or your goals and labs suggest that using one of these hormones or one of these supplements or one of these small molecule drugs is going to be beneficial for you, then yeah, great. But your symptomatology, your goals, and your labs all need to align and corroborate to effectively build that plan for you. So, let's say we have a woman come in and she's progesterone deficient and her testosterone is also at the suboptimal. Progesterone deficient via just looking at a progesterone to estradiol ratio and suggesting that she's estrogen dominant in that example, then yeah, maybe you need a little bit of progesterone in your life, and it'll help with some PMS symptoms. It'll help with your sleep schedule. It'll help with your ability to lose weight more effectively. It'll help with bloating. Then on the other side of it, maybe your testosterone, your free testosterone is like 1.2, 1.3, 1.4, maybe it's in the 2s or even the low 3s. Those are all normal values, right? But most people feel their best on the upper limit of testosterone. Most people, it's kind of like the example of if you drive a car off a lot, brand new vehicle, awesome. Full tank of gas. It's got a full tank of gas. It's a beautiful car. It's great. But what's the difference between a full tank of gas in that brand new vehicle and a full tank of gas in a 20-year-old vehicle? It's still a full tank of gas, right? So it doesn't matter your age. It doesn't really matter what you're looking at here. A full tank of gas, full tank of gas. And I don't think about testosterone any differently. So independent of your age, high into testosterone is really where you're going to feel the best most of the time. And that's my opinion. That's where I like to keep my testosterone. So I think, implementing something there can really help with anabolic changes, can really help and stimulate your body's ability to burn a little extra fat. It can really help with getting you to feel a little bit more dialed in cognitively, and really help with your adrenals. So simple testosterone, progesterone replacement there can really be a game changer for a lot of female athletes, as well as testosterone replacement in men. And a lot of guys have experience with it. It is a game changer in a lot of cases. It's usually not the answer, but it is a game changer, right? You got to figure everything else out to figure out what the answer is. And sometimes it comes down to thyroid. You look at thyroid and you say, your goals are to drop some weight here. We need to get the fat off of you. We need to stimulate you metabolically. So why don't we throw some thyroid into the mix? Maybe some T3, which is the type of thyroid that really packs a punch. There's T4 as well, which a lot of doctors like to replace T4, but your body has to convert T4 to T3. And T3 is what actually, that's the thyroid, that's the stuff, so why not supplement both, or just T3 in general? Anyway, I sorry for the long.
No, it's good.
Response.
Appreciate
I would say for sure that, majority of females that come in, especially ones that are in your, bodybuilding community, are 100% estrogen dominant, meaning that their progesterone in relation to their estrogen is low. And that's because any type of stress to the body, whether it's mental, physical, emotional, and, you know, with bodybuilders, they're putting so much stress on their bodies, right? With the workouts and the cutting phases, you are depleting progesterone. 100%. And when progesterone is low in relation to estrogen, you're going to feel, you know, more moody. You're going to have more anxiety. You're going to have a harder time sleeping. Some people develop insomnia. And so I would say, especially for females, most that come in that are in this community do have low progesterone levels in relation to estrogen. And that's going to also make it a lot more difficult to lose fat and have that lean appearance as well. So just to add on top of that.
That's great. I appreciate the addition. And I find all of this just so fascinating because this sport is, it does have a lot of different facets to it, whether it's natural competitors, enhanced competitors, vegan competitors, I don't know, carnivore competitors, whatever you want to call it these days, like what people are doing. But how do you, or maybe what special considerations might you have for athletes who are enhanced?
I guess, what do you mean by special considerations?
Like if they're already taking like PEDs, wouldn't that impact a lot of these levels?
Right. Yeah, absolutely. So, I mean, you need to make sure you're doing all the stuff to mitigate the side effects, right? So a lot of times, a lot of these PEDs are going to really stress your liver. So maybe you need to throw some TUDCA in the mix. Maybe you need to really be offloading free radicals and stimulating your body's production of glutathione, which is, you can do that through something called N-acetylcysteine. But again, we got to get those labs and we got to see, you know. So the first and foremost, and I guess the theme of this whole talk is can't manage what you don't measure, you know. But I think for those, generally what I see in a lot of those competitors is reduced kidney and liver function and gradual increased insulin resistance, because maybe they're using growth hormone, and growth hormone, what it does is increases something called insulin-like growth factor. Insulin-like growth factor is insulin-like growth factor. Finds very similar and even gets the same response out of receptors as does insulin. So if you're hitting on those receptors with insulin-like growth factor, same as insulin, you're going to hit insulin resistance. You're increasing your risk for type 2 diabetes. So in some cases, maybe in a recomp or depending on what your goals are in a maintenance phase, maybe it makes sense for you to do a course of something like metformin, right? So, something to really work on insulin resistance, insulin sensitivity. Or since metformin can interfere with your anabolic potential, maybe somebody might respond much better to something like berberine. So there are a lot of considerations there on the insulin front, but the other side of it is, how do you manage somebody when they come off of these hormones, right? Do you just let them feel like, in a very dark place coming off of some of these PEDs that they're using? Well, no, you want to support them. So you want to make sure that you're doing an appropriate post-cycle therapy, and that truthfully just needs to be customized to the patient, to the person.
Ooh, actually, can you expand on that? Because I've had some girls reach out to me about how they were put on PEDs and then they just, they cycled off, or they didn't have much support from their coach after being put on them, and they ended up feeling like a dark place. So can you describe what that might be like? So someone listening going through it might feel, oh, I'm not alone, and there's a way through it.
Right. So, I mean, you have to get labs, right? And oftentimes what you see there is again, they go to that dark place where their metabolism slows substantially. They aren't getting the same sense of well-being as they were getting from the PEDs before, because their body's not producing the same neurotransmitters. Certainly a lot of those PEDs, they give you an upregulation of serotonin. It feels good. So from there, you really need to make sure that you're supplementing with the right things to boost your neurotransmitters, maybe something like 5-HTP, which is a precursor to serotonin. Maybe it makes a lot of sense to switch to an exogenous testosterone. Maybe you were running something like Anavar or stanozolol. I don't know. Whatever people are using these days.
Everything.
So everything, right? So whatever you're using, maybe it makes sense to transition to something like that before transitioning off. Or you could use something like a selective estrogen receptor modulator. Using a lot of guys, why can't you use it in girls? Of course you can, right? To get your body to produce more of your own sex hormones. So something like Clomid would be very reasonable. Yeah.
Amazing.
But it just depends on the labs, depends on what the doctor is actually going to recommend for you. And then, after the fact, it's something that Julia and I would help our clients put into action.
Amazing. Well, can you guys explain how Liv Health system works? Like, what can people expect because I know that you guys are offering like 1 month free with sign up. So can you explain what that person could expect when they enroll and what those steps look like?
Yeah, for sure. Absolutely. So when somebody signs on with us, they are first prompted to fill in a medical intake form, right? Because our goal is to really understand who they are, what's going on with their health, and what their long-term goals are. So they'll spend about 20 minutes going through a medical intake form. And once that form is filled out, they'll spend about 45 minutes up to an hour with a health concierge, so myself or Andrew, really, kind of taking a deep dive into their medical history and everything that they filled out on that intake form, so that we have a really good picture of who they are, where they are, and where they want to go. And so that the doctor knows a lot about them before they even meet the doctor. And from there, based on that conversation, we typically will decide what labs we need to run. So we can't stress enough how important it is to get those labs done. But everyone is a little bit different, and the labs that we decide for each person can look a little bit different as well, just depending on, again, your history, where you're coming from, what your goals are, et cetera. And so we'll typically set you up to go get a lab draw at your nearest Quest or LabCorp. And then as soon as those labs come back, we schedule you in with our doctor. So that's typically the way that the system works. They'll spend about an hour with our doctor going through their labs, and the doctor really will spend a lot of time going through every single lab that was ordered, what it means, where it is, and where it needs to be for their goals and for their longevity. And so they're really getting an hour with their concierge, an hour with the doctor before a treatment protocol is even recommended. So they're getting a lot of time there. And then once, we decide on a treatment protocol, everything is ordered and shipped directly to them. And so that's the premise of how kind of it works to get onboarded.
Amazing. And how do you pair someone with a doctor?
Depends on where. So we're nationwide, licensed in all 50 states. Some states we have several doctors. Some states we only have 1 or 2 doctors. So if we do have an option for multiple doctors, it really just depends on who's going to be the best fit. We do have specific doctors that really love to work with bodybuilders. We do have some doctors that really like to work with sort of the biohacker type people. We have some people that really like to work with just frank hormones and just want to work with people that are just looking for hormone replacement. So it really depends on who's going to be the best fit, and we help to determine that on that call. And then in follow-up, you get labs as often as the doctor deems necessary or whenever you want, and you meet with your doctor and your health concierge whenever you need to. So it truly is a concierge model. It's, whenever you need, whatever you need, we get you covered.
Love that. Okay. When you guys offer or provide supplementation advice, I know you have your own supplements. Can you talk a little bit about the supplements you've produced that you're proud of? And then also maybe what would happen if someone wanted to or needed to take supplements that were not manufactured by you guys?
Yeah. So we have a few supplements on formulary. We've got a multivitamin, we've got vitamin D, we've got DHEA, we have fish oil. We got a few things that are actually very cool and in the realm of what maybe some bodybuilders might be interested in. But generally, if it's something that we have that we really believe in, then we encourage our clients to use it. And if it's not, then I'm totally okay swallowing my pride and ordering the supplements for the person from some other source, because there are better supplements out there, right? So for example, like fish oil. Our fish oil is good. I like our fish oil. Are there better fish oil supplements out there? Yeah, probably. So if somebody needs a really high potency fish oil, then yeah, let's get it for them. We're actively trying to figure out the best fish oil that we can produce through pharmaceutical resources. But it's not a, hey, you have to use our supplements. I don't really believe in people that say you have to use all our supplements, because typically people don't have all the best supplements. That said, one thing that a lot of bodybuilders like is something called Epicatechin that we produce. And Epicatechin it's a polyphenol supplement. So it's actually really great for your immune system because it helps you to offload what are called senescent cells. Now, senescent cells and simulate autophagy, but senescent cells are essentially aged cells that are no longer dividing. They're just sort of hanging out and producing inflammatory factors that aren't really good for your overall longevity. And they're just taking up space and increasing your risk for chronic disease. So you want to offload those. But perhaps the coolest thing that a lot of people, or how it gets people's attention, is that Epicatechin does, is that it's a weak myostatin inhibitor. So it's myostatin is, and Celeste, we were talking about this before, but the myostatin is a hormone that's produced that tells your body, okay, you've produced enough muscle. So I don't know if anybody any of your listeners have heard of Belgian blue cows or a double muscled cow. These are cows that don't have the gene that encodes for myostatin. So if you look them up on Google, it's like, oh my God, what's going on here?
Seriously.
It's crazy. But that said, so if you can find some weak myostatin inhibitors in the environment, something like Epicatechin, you can get some pretty significant changes within as little as 2 weeks with using a supplement like that. But that's one supplement that we like, that we have on formulary, that a lot of our bodybuilders, a lot of our performance athletes like, because you can see improvement in hypertrophy and anabolic changes, as well as improvements in general strength.
That's awesome. Yeah. When you told me about that, I was like, dang, I could see that being really, really beneficial for competitors. Right. I mean, I would imagine females and males, because
absolutely.
There's that threshold.
It can also improve kidney function, which a lot of people are, struggling with in this realm because of the stress they're putting on their body.
That's awesome. How quickly does something like that work? Like, are people expected to take this consistently for a certain period of time? Does it stop working if you stop taking it?
So I mean, it's going to stop working if you stop taking it. Eventually you'll go back to the way you were. But you probably sustain those changes, right? What was that, Julia?
Oh, no, go ahead.
But it's about 2 weeks you can see results, as long as you're dosing it properly.
And does that work with someone who's in a caloric deficit or surplus?
It would work better with somebody that's in a caloric surplus. It would probably help to maintain muscle for somebody that's in a caloric deficit more so. Most of my bodybuilders I work with have not elected to use it during a cut. They've elected to go with other potentially more potent things. Most of the bodybuilders I work with personally, and I think Julia's worked with a lot more natural competitors, I work with a lot more enhanced competitors who are, Epicatechin versus a growth hormone secretagogue nandrolone decanoate or testosterone cypionate and propionate. Those are sort of it's like comparing a dime to a dollar,
Yeah, I could see that. But I like that there's options for natural competitors too, to consider to enhance their performance and their growth potential and what they can do without feeling like maybe they're going against their value or commitment to remaining as natural as possible. Okay.
Yeah, for sure.
So with that said, obviously we've broken down the system of how it works. That's awesome. And they would send through their information, fill out the questionnaire, all these things. It's clearly very customized. The main thing that we focused on in this call is you can't manage what you don't measure. So I really like that takeaway. Is there anything I didn't ask you guys that you think I should have asked?
One thing that we help a lot of people with is, and we didn't really touch on it, was sexual function. So if we could take a second just to chat about sexual function, I think that would be huge. and a lot of the stuff that you can use for libido is actually really helpful in the gym. So when you're talking about libido in men or women, a lot of times people first turn to supplements, right? And supplements are great. There are some supplements that really work there. Something like ashwagandha can help to boost testosterone. Other things can help to push down on sex hormone binding globulin, maybe something like stinging nettle extract or boron. These are things that maybe you are a woman that's on birth control, and because of that, you're just not getting that turnover of testosterone. Well, that could potentially help, stinging nettle and boron. Then other things to consider there, though, a lot of people are coming to us and they're like, hey, what do I do? I just have no libido. Things aren't working the way they used to. I've eliminated my period, or I'm in a state of amenorrhea, whatever it might be, and then it all correlates, right? So then how do we get that libido back? Well, we need to get your hormones in order, but oftentimes we can implement something like tadalafil, which tadalafil is great because it helps men with erectile dysfunction, but works the same way in women as it does in men, right? So, and consider that a clitoris is the same thing as a penis. So if you can improve sexual function in that manner, great. But consider what tadalafil is. It's Cialis, but it originally was a blood pressure medication with a side effect of erections. Now it's an erection medication with a side effect of reduced blood pressure. What it's doing is it's decreasing your blood pressure to your appendages. So, well, what does that mean? Well, that means that if you're using that when you're in the gym, you get a substantial pump, much greater than you would otherwise. So you get a much more vascular effect out of it. And it's something that a lot of our competitors are using on a regular basis to, one, help with their blood pressure, two, help with their performance in the gym, and then three, lastly, is help with sexual function. Now, all that said, there are other things out there. A lot of people are using things like oxytocin. Oxytocin is the love hormone. Everyone loves oxytocin. That said, you can also use it to help boost metabolic activity and maintain a higher level of muscle mass and drop fat. At the same time, you're loving your partner a little bit more. So these are all things that help with sexual health, but also help with performance. And there are several other things in our armamentarium that you can implement that typically these things that help with sex, they're also going to help with performance.
That's really interesting. And you said that could be because of like where the blood is distributed, and that would help with pumps, but is it due to anything else? Like, does it change anything else within your system?
No, I mean, things like tadalafil and Cialis have very few side effects. Some people get a little bit of heartburn. Maybe somebody gets a little bit of lightheadedness or a slight nausea or a headache. That's very rare. It's usually very well tolerated. And generally in very low doses, right? There's no reason to go with a crazy dose of it, but our doctors are typically recommending, something in the 2.5 to 5 milligram range, just depending on the patient, on tadalafil. And, that can be very helpful, especially for the performance side of things.
No, I'm really glad that you shared that, because I find that so fascinating, and I'm sure a lot of listeners will too. And you also brought up the fact that a lot of competitors experience amenorrhea. How might you address that as well?
I think one of the biggest things, with amenorrhea is, well, of course, if you're on birth control for a long period of time, you can certainly experience that. And it can take some time for things to get back to normal. I think, one of the biggest things, again, we talked about this, but is that stress on the body, which can certainly really deplete that progesterone, which plays a huge role in not being able to get your period back. Typically what you see is people that have really low progesterone, stress induced, you really have to mitigate as much stress as possible in order to regain your period. So whether it's mental, physical, emotional, doesn't matter what kind of stress, that really has to, be brought down as much as possible. I'm a good example of that. I was on birth control for many, many years. And also have put a lot of stress on my body physically for the most part, and didn't have a period for a very long time. So was experiencing that. And so I had to, bring down stress as much as possible, but also have my hormones looked at once I was off birth control to see where they were sitting, and did use the help of testosterone therapy and progesterone therapy to help regain my cycle as well. So it goes back to, looking at, why you're experiencing that amenorrhea by getting those labs done, seeing what the problem is, and then potentially using some bioidentical hormone therapy to help restore your cycle again, in addition to stress management techniques and making sure that you're getting the proper sleep and that you're eating enough calories, that you have enough, I know this community is not going to like it, but enough fat on your body where your body feels safe to cycle again. I think that's, one of the things in this industry is people are afraid of body fat, right? I've seen that quite often. But what we know is that not having enough body fat, you have infertility, you have amenorrhea, you have hormonal imbalance, you have mood swings, constant fatigue and low energy, decreased thyroid function, brain fog. And so, in order to restore your period, your body needs to feel safe. And when we don't have enough body fat, your body's not going to feel safe. So we do sometimes have to reverse diet where you will gain a little bit of body fat, but know that it's in your favor long term.
And I guess that complements the earlier discussion on proper reverse dieting and how that can be beneficial long term for other reasons.
100%. Yeah. So it's not just about, metabolism, but I think the amenorrhea it's a huge problem amongst bodybuilders, is losing that and restoring that. Yes, you need to reverse diet properly. You need to look at your hormones to see, okay, why am I, potentially not getting a cycle? Is it because I have low progesterone? Is it because my testosterone is in the tank? Is it because my DHEA isn't where it needs to be? So there are so many components to look at to figure out, why am I experiencing amenorrhea, not having that cycle, and what do I need to do to help myself lower stress, get progesterone where it needs to be, look at all of your sex hormones to see, what do I need to do here? And again, it goes back to the labs, right? To figure out why is this happening and what do we need to do to help restore?
Yes. And speaking from experience, be gradual in the effort. Cause when I was struggling with this, I was like, I'm going to try everything all at once. And I think that actually worked against me long-term because I gained way more fat than what would have actually probably been healthy for my body to actually feel safer. And I didn't have the proper guidance as far as the blood work went. And so this past year, I got it back much quicker with a more gradual and methodical approach, because I actually looked at these things that mattered and would directly influence it rather than guessing.
Right. Yeah, definitely that slower approach, but a multifactorial approach, right? And looking at kind of every aspect between the body fat, the stress, the sex hormones, all of it.
Amazing. So you guys listening, I was given a code. It's Bikini Pro. That's going to get you 1 month free with Liv Health system. I'll put all that information in the show notes page, along with their Instagram, website, everything. Don't forget too, we will be timestamping this episode and having full summary notes. So you'll be able to go back and, okay, when we were talking about this particular issue, what time was it at? So you can re-listen to it and get all the golden nuggets from this episode, because there was certainly a lot. I have tons of notes. I'm like, oh my gosh, this is amazing. So Andrew and Julia, thank you so much for just sharing your expertise and your time.
Yeah, thanks for having us.
Absolutely. Thank you.
Yeah, it was awesome. And if anyone wanted to connect with you two specifically, or maybe further this conversation, is there a way that they could do that?
I think, probably the best option would be to send us a direct email. My email is andrew@livhealth.com, and Julia, yours is just julia@livhealth, right? .com?
Yep, julia@livhealth.com. Yes.
Awesome.
I think definitely a direct email there. Again, it's Andrew or Julia@livhealth.com, which is LIVHEALTH.com.
Cool. I'll include those in the show notes page too, in case people had more questions or specific things, but you guys can also go to their website, learn more. And then if you do decide to move forward and try it for a month, you've got that code. And if you guys have any questions, I'm sure, you know, they're obviously very open and willing to discuss. So I appreciate you guys tuning in to another episode of the Inner Health series. And I hope you all have an amazing rest of your day, night, or morning, wherever you are in the world while you're listening to this episode.